navigating the body. So every profession seems to like to create its own language. And some of this is out of necessity, and some of this is out of exclusivity. It kind of keeps certain people in the club and other people out of the club. And so we are going to be learning medical terminology. This is the terminology that doctors use and physical therapists use and massage therapists use and very good personal trainers use and people of that nature. It's also fairly universal. So the Latin stuff is fairly universal. And you go to other countries and they use the same type of Latin terms. And it's extremely important because we need to be able to talk about human bodies and places on them and spaces on them and where they are and depths and all sorts of stuff. And we need it to be relative to the client. So we need to actually avoid terms that use up and down just regularly, because if we say, well, this is up here, the problem is, what if I'm laying on a table? Then my head is no longer the highest thing anymore, right? So we've got to use different kinds of terms. So I really want you to, this is not super hard stuff, but I really want to make sure you get it really good. Because we're also, after we talk about navigating the body and like what we call certain areas and things like that, which we've already played with a little bit in this class, we will also be talking about actions. And that is a little trickier. And you must get your actions. Because if you can't talk about how a body can move, then talking about the muscles that make that happen becomes just impossible. And so I think, Ms. Hanson, you're here. I'm just going to utilize you. Do not have to agree with me, but I think Ms. Hanson will agree with me that it's very difficult when you kind of forgot your action, and then I'm asking you about the muscle that does it, and you're trying to figure out, is this a flexion, extension, all that kind of stuff. It makes it very hard. So this really rudimentary stuff, if you get it really well, it really helps the next steps. Really helps the next steps. And we literally have to talk about, like, what we call it when my fingers do this, and when my fingers do this. And there are ways to talk about all that stuff, and so we'll discuss that. And then later we will talk about bones and muscles and how they create those movements. And again, we care about all this because we're really movement specialists. Most people are going to come to you because movement is uncomfortable for them or impossible for them or something, right? And so like they're going to come to you and be like, it hurts when I turn my head. That's a very common complaint. And we need to be able to figure out why that's happening. So first we have to be able to talk about what is this called, and then why is it not happening. So that's the whole point. All right, so before we get started, I want to talk about something called anatomical position. So, anatomical position, I'm going to move this thing so we can get way back here. Hold on. That's kind of fun. All right, anatomical position is this. Palms out, you can see my palms. I'm exaggerating a little bit, but the point is, ready for jumping jacks, just like this. I'm going to make some points about this, but this is called anatomical position. And if we're trying to figure certain things out, which I will show you here in a second, we pretend like the person is in anatomical position. So here's what I mean by that. When I stand in anatomical position, I'm like this, right? Do I walk around like this? Yes, I do. Like this, all day long. No, I don't. Actually, what naturally happens is my arms turn in like this for sure, right? Well, let me tell you. What's the word for front?
Anterior.
Anterior, yes. These are my anterior forearms. Right here. These are my anterior forearms. Because you imagine me in anatomical position. They are still my anterior forearms, but they're posterior right now. That's why we need anatomical position. We don't call them. Literally, this is my posterior forearm. What you see most of the time is my posterior forearm because this is anatomical position. I know that's a weird thing, but that's why we do it. So that we have to have some point of reference. So we would say this is anterior forearm, this is anterior brachial region. We'll get to that in a second. Even though they kind of turn in when I walk, Now we would say this is posterior. You'd be like, but the posterior is in front. It is, because this client, this guy here, is choosing to have his arms in like that. But that's not our problem. This is anatomical position. So everything that you can see right now is all anterior right now. Everything you can see right now is all posterior until I go back to a normal person, and all of a sudden you see my anterior forearms and the rest of my posterior body. I hope that makes sense. Yeah? So that's anatomical position. And so when you get really confused, you actually kind of imagine somebody in anatomical position. All right, let me present this slideshow, and we're going to kind of go through regions of the body. I really like this stuff. I don't know why, because normally I wouldn't, but it's kind of fun. Okay. Okay, can we all see a naked person on my screen? Good, that's massage for you. Okay, so these are regions of the body. We no longer call the head the head. We actually call this entire head the cephalic. So this entire head is called the cephalic region. Now, within the cephalic region, there is a cranial region on the back of my head, a facial region in the front, even a mandibular region, which is my mandible. But this whole head is called my cephalic region. Yeah. Mr. Tate, what's this whole region up here called?
The cephalic region?
You are right, sir. Hey, sir, what's this region within my cephalic region? This jaw here called? It's on the woman in the picture.
Okay, the
Mandibular.
Oh, damn it, the mandibular.
Look, Mr. Tate.
Yeah.
Every time he messes up, he's like, great. Thank you, sir. That was fantastic. Yeah, you're fine. This is all good. Mandibular. So, by the way, what do you suppose this bone is called? Just FYI, it's called your mandible. It's in the mandibular region. Anyway, okay. Miss Rotson, what's this whole region up here called?
That would be your cephalic region.
That's true. What's this part right here called?
Your mandible?
Yes, my mandible. Hey, what's this area kind of back here called?
It's been a while.
You can also look at the picture on the guy.
I know, my laptop's acting up. So.
Oh.
Cervical area? Oh,
Well,
back of the head.
What? Back of the head.
I'm not really. I'm not picking up.
Cranial?
No. Cranial.
We'll take it. We'll take cranial. Cool. And by the way, what do you call this face region?
You're picking on me. Facial region.
Yeah! Yeah. Of course I'm picking on you. Why not? Okay, thank you, ma'am. Thank you very, very much. Miss Suriel?
Yes,
What region of my body am I touching right now?
is the maxillar.
Well, you are very smart. This is your maxillar region. But what's this region from the picture on page 20? Mandible, yes. By the way, she's right. This is sometimes called the maxillar region right here. But anyway, we also call this whole facial region, what do we call this, Ms. Suriel? Page 20.
Facial region,
Yeah, I love that. What do we call this whole thing here?
cranial region,
Cranial is usually more like your skull cap kind of stuff. What do we call the whole head?
skull,
Did you say school? Oh, skull. Skull. Cephalic. Cephalic.
oh, cephalic. Okay.
Cephalic region. Cephalic. Head-like. Okay. Good. Yeah. Miss Hawks. Miss Hawks, what is this whole area called?
It's your cephalic.
Cephalic, yeah. What am I touching right now?
Your mandible.
Yeah. Mandible in my mandibular region. What region of my body is this?
Like here? Like here?
This whole facial region.
Facial region?
Yeah, let's call it facial. And what do we call this region back here?
The cranial?
Cool. Thank you, ma'am. Good. I like it. Okay. Then we get down to my neck, but we don't call a neck anymore. Right? Remember the vertebrae we learned that are in this area? How many vertebrae are in this area? Oh, I see 2 people, 3 people. Thank you. 7. You're absolutely right. 7 vertebrae in the cervical region. This is my cervical region. Right? It's my neck. Right? There will be days you'll want to ring my cervical region. Who is... Oh, Mr. Brown, you raised your hand, sir, please.
Why is the neck called the cervical region if the cervix is down below?
Because cervical and cervix are 2 different things. I mean, it's a very legitimate question, but you're just assuming because they kind of sound alike that they are alike, and they're not. They're not from the same roots, if that's what you mean. Yeah. Sorry.
So how you said 2 different people named different things and stuff like that?
Yeah, and it's also like, I'm trying to think of a really good example in the English language, but, well, I mean, the minute you change one letter on a word, it's a different word. Right?
Yep.
Fast, remove the S is fat, and they have nothing to do with each other. I just removed one letter. And you're kind of doing that. You're saying, hey, these kind of sound alike, but, you know, cervical and cervix, to me, sound very different. They both just start with sir. You know? Does that make sense? Cool.
Yeah, that makes sense.
Okay. How many cervical vertebrae do you have, sir?
7.
Yeah. Good. How many thoracic vertebrae do you have?
Thoracic.
Yeah, they're below the cervical. You've got one for every rib you've got, by the way, if that helps. Every pair of ribs.
So 6.
12.
No. 12. I underestimate myself. I always second guess myself.
Yeah, you need all 12 of the ribs. Those are good. 12 ribs, yeah. How many lumbar vertebrae do you have, sir?
Lumbar vertebrae?
Yeah.
That's your spine, correct?
It is your spine. Yes, sir. It's not fair. I've only gone over it once. I just thought, you got cervical right, so then I started heading downstairs.
I don't remember with the
5.
lumbar.
5. You know what's really interesting to me? Everybody, you've got 7 cervical vertebrae and 5 lumbar vertebrae. And what's 5 plus 7? 12, and you've got 12 thoracic vertebrae. It just helps me remember a little bit. Okay, thank you, sir. Let's see. Hey, Miss Vincent, what region of my body am I grabbing right now?
Supraclavicular.
Yeah, I know what you're saying. So clavicle is good. What she said was supraclavicular, everybody, and it's not wrong, really. What does supra mean? Above, and this is the clavicle. Above the clavicle. And if I was in anatomical position, by the way, if I was laying on a table, you still imagine me standing up. If I'm in anatomical position, here's my clavicle. The supraclavicular region is the region right above it. The only difference is, just so we all know, my cervical region is really my whole neck. My supraclavicular region is usually just this soft spot above your clavicle. But technically speaking, she's right. Anything above here is supraclavicular, but it's this soft spot that you can push into and access actually some really interesting muscles, but that's a whole other story. Okay. Cool. Do you remember yesterday when we talked about the shoulder pads out here on your body? Do you remember that? Remember they were actually a process on your scapula. Follow the spine of the scapula up and you get to the acromion process. This is the acromial region. Yeah? Yeah. Okay. Miss Estes, What region am I touching right now?
Mandibular.
Mandibular region.
Facial region.
Yes.
Cranial.
Yes.
That is the cephalic.
Cephalic, yeah. Well said, by the way, too.
That is the cervical.
Cervical, yes. Right above my clavicle here.
I'm gonna look at the book. Supraclavicular.
Yeah, and completely appropriate to look at the book. That's fine. That's what it's there for.
Okay.
And what's this?
And then that is the acromial.
Yeah, good, cool. You guys will learn, thank you, by the way, that was fantastic. You guys will learn even if you read your book. I'm fine with that. And then when you feel confident enough, you can test yourself. But I'm not testing you, I'm just drilling you. I'm also testing the audience to make sure the concept is there, if that makes sense. Cool, cool, cool. All right, I love that. Okay, here, your chest, pectoral region, right? Pectoral region. Men and women, pectoral region. Pectoral region. Not an armpit. Axillary region. Axillary region. So pectoral, axillary, acromial, cervical, cephalic, cranial, facial, mandibular. Yeah? How are we feeling about these? Yeah? We should drill them, Miss McDowell. That'll help. Thank you, Miss McDowell. Miss McDowell, what's this whole thing called?
Cephalic region,
Cephalic region.
facial,
Yes.
mandibular,
Yes.
cervical,
Yeah. Right above my collarbone.
supraclavicular,
Yeah.
acromial,
Yeah.
pectoral,
Yeah.
axil. I know that's the axillary.
Yeah, axillary. Axillary region. Cool, cool, cool. Thank you. Thank you. Mr. Blygen. Hello, sir. I like your shirt.
Thank you.
Mr. Blygen. What area am I touching here?
The mandibular region.
Yeah. What area am I touching here?
The acromial region.
Yeah. What area am I touching here?
Pectoral region.
Yeah. What area am I grabbing here?
Cervical region.
Cool. How many cervical vertebrae do you have?
7.
Yeah. Okay. Cool, cool, cool. Your book, by the way, if you go down lower, everybody, your book kind of shows the upper back as your thoracic region. Do we see that? It looks like thoracic or thoracic, but it's thoracic. Do we see that? I want you to realize something. We normally call the back there thoracic. That's true. But your thoracic region is anything associated with a rib. So yes, this is your thoracic region, but really so is this. This is your thoracic region too. So your pectoral region is in your thoracic region, just like Phoenix is in Arizona. Does that make sense? So actually, if I did something like this, you could be a smart ass, you could say, well, that's your thoracic region. You'd be 100% right. I'd be like, no, but I meant more specifically. You'd be like, okay, your pectoral region. But your pectoral region is on your thoracic region. Your thoracic region is anything associated with a rib. You have 12 ribs. They're attached to 12 vertebrae, 12 thoracic vertebrae. That's why it works that way. Your thoracic region is anything anterior, lateral, or posterior that is associated with a rib. If you touch somebody and you find a rib, you are most definitely in their thoracic region. Yeah? Good times. Okay. Cool, cool, cool. I like that.
You
Yes?
said lateral or posterior?
Yeah, what I was trying to say, sir, is I just meant like your ribs wrap around your body.
Okay.
Don't worry about those. I was just trying to point out wherever you find a rib. If I lift up my arm, that's thoracic. That's thoracic. I know because I'm hitting rib. This is thoracic back here. Yeah. If it's associated with the rib, it's thoracic. It's not just the back. And by the way, just like places in Arizona, we sometimes use more than one word for stuff. So, dorsal means back. And so I'll often say this is the dorsal side back here, right? Because it's the back. Or the dorsal side of the thoracic region. So we'll often mix and match this stuff kind of in weird ways, but don't worry about that yet. Okay. Anything associated with the rib is thoracic. Yeah? Okay. Miss Sarno. Hi. Hi. We're going to review these together for everybody, okay?
Okay.
Okay, so I'll say it and show it, and then you say it. Okay? Okay. Grab your head like this, Miss Sarno. Grab the whole thing. Say cephalic.
Cephalic.
Thank you. Now, grab this. Say mandibular.
Mandibular.
Bam, good. Grab your face like this. Say, no, I just forgot. Oh yeah, of course. Facial.
Facial.
Sometimes I wonder about me. Grab back here. Say cranial.
Cranial.
Beautiful. Grab right here. Say cervical.
Cervical.
Touch right here above your collarbone. Touch right in here. Just yeah, thank you. Perfect. Say super.
Super.
Clavicular.
Clavicular.
Superclavicular. Cool. Touch here and here. Say acromial.
Acromial.
Yeah, cool. Cool. Touch under here. Say axillary.
Axillary.
This is great. Touch here. Say pectoral.
Pectoral.
All right, and all of this is thoracic.
Thoracic.
Good. Thank you. It's been a pleasure.
Thanks.
I love that. Cool, cool, cool. All right. Let's move on down. I've got my cervical region here. I've got my thoracic region. And down here, I've got my lumbar region. Right? You guys have lumbar support maybe in your Mercedes-Benz that you drive to school. Yes, Miss McDowell, please.
I'm sorry for interrupting. I was kind of looking ahead. Why are the hands and the feet called dorsal? Why are they the same?
I kind of have an answer.
Okay.
Okay, so, I mean, I don't know why they're both the same. That part I don't really quite understand, but dorsal means back or backside, right? A dorsal fin on a shark, right? So in anatomical position, this is my palmar side. These are back. They are dorsal. So the tops of my hands, when we think of the top of my hands, in anatomical position, they're called dorsal because they're the back. They could have been called posterior. I don't know why they call them dorsal. But they mean kind of like the back of your hands, right? Dorsal, just like this is where I have a dorsal fin. Dorsal. Now the bottom of your feet are called your plantar region, the whole bottom of your feet. And so they're kind of thinking the tops are kind of like the back of your hands. And that's why they get dorsal. So there's, in some ways, you can think like there's 3 dorsals on your body where we use that term. Back of my hands, top of my feet, and back of my back. Yeah. And very much like English, they're used kind of loosely, right? So I might want to give more accurate stuff. Like I wouldn't just be like, It's in the dorsal region. You'd be like, I don't really know what you're talking. I'd be like dorsal region of the foot, dorsal region of the hand, superior dorsal region. I wouldn't even probably use it for the back. I'd be like posterior thoracic region, you know, lumbar region, things like that. But those would all be dorsal. So it's kind of their version of back for me saying it like that. Although the top of the feet thing is really confusing. Cool. Thank you. I don't think that was going too far ahead. I think that was appropriate, Ms. McDowell. Okay. Where is, well, let's go a little bit further. So that's lumbar. After we go to lumbar, we've got sacral. And that's back here. Sacral. You should be able to feel your sacrum, and it should feel like a flat bone, kind of between your buns at the top. But you should be able to feel, that feels kind of good actually. You should be able to feel your sacrum back there. Your sacrum, it's the bottom of your spine, and it's an important bony landmark. It's a place that we use to judge where somebody is underneath a sheet. So sacrum is really important, and that's the sacral region. So we've got the cervical region, thoracic region. Cervical region's got 7 vertebrae. Thoracic region is anything associated with a rib, front and back here, but there's 12 vertebrae. We've got 5 lumbar vertebrae in the lumbar region, and we've got the sacral region, right? The sacral region is kind of between the 2 gluteal regions, right? Sacral region, 2 gluteal regions, right? Because your gluteus maximus actually is sewn into your sacrum. It's the reason our buns look the way they do, is that sacrum's in between them, and they're kind of hooked onto it, right? So that's your sacral region. Cool? Cool, cool, cool. All right. Ms. Carodi, are you ready to do this? Hi. Oh, okay.
Yes.
Ms. Carodi, just repeat
Yes.
just repeat after me. So this region right here, cervical.
Cervical.
Cervical. This region right here, thoracic.
So thoracic.
Good. This region right here, lumbar.
Lumbar.
Yep. And this region down here,
Yeah.
sacral.
Sacral.
Good. So cervical,
Cervical.
thoracic,
Thoracic.
lumbar,
Lumbar.
sacral.
Sacral.
Thank you. Ms. Joan?
Yeah.
Ms. Joan? How about we
Yeah.
do you too? What is this region? Cervical,
Cervical,
thoracic, thoracic.
thoracic,
Good, good, good. Lumbar,
lumbar,
yeah, and sacral.
sacral,
Good. One more time. Cervical,
cervical,
thoracic,
thoracic,
lumbar,
lumbar,
sacral.
sacral.
Very good. Yeah, we're doing good. That's good. You guys will use, by the way, cervical, thoracic, lumbar, and sacral for the rest of your lives. All the time, for everything. Cool, cool, cool. Thank you both. Good stuff. In your book, by the way, they call something pelvic area. Pelvic area is very confusing because it's anything associated with your pelvis, so it can be front and back. Your gluteal area is kind of on your pelvic area. But like this is your pelvic area up front, this pelvic area in back here, it's anywhere with your hip bones. So it's a little bit confusing. A little bit confusing. And of course your gluteal area is where your 3 gluteals are, right? Is that right? Ms. Trotter, what are your 3 gluteals?
Gluteus maximus, gluteus minimus, and gluteus medius.
Medius, yeah. Good stuff. Yeah, cool. Which one of those is the biggest?
Gluteus maximus.
Yeah, good job. Which one's found in, well, they're all found in the gluteal region, never mind. Okay. Okay, let's keep going down the legs. The back of your knee is called your popliteal. Have you ever been standing there, maybe in middle school, and you're standing there and you're unaware and somebody came and pushed on the back of your knee? and popped it out. You almost fell and you caught yourself. You ever done that? They popliteal. That's how I remember that. Popliteal. Cool? It's the back of your knee though. It's your knee pit. It's your axillary region of your leg. Yes, Mr. Brown.
So I have a funny story about that.
Please enlighten us. Regale us.
I actually, the doctor diagnosed me with my knees. They hyperextend.
Oh yeah.
So they go back like really far. So whenever the kids at school used to try to do that, they used to pop my knees to get me to fall. It would just pop them to how their knees would normally be, and they would always be upset because they're like, we can never fold him, and because they would just go to normal instead of folding.
Excellent. I like that. Do you know that there's actually a muscle, probably on you, that is elongated, and it's one of the reasons that your knees hyperextend? And that muscle.
I was actually going to say that too, because yesterday when I was doing the homework, I saw in the book it was talking about flexation and extensors.
Yeah, flexors and extensors.
And it said when a muscle is elongated like improperly or too much, it hyperextends, and I was going to ask you about it.
Yeah. I mean, you've got things like your hamstrings and back there that do that too, but you've also got something called the popliteal, which is a muscle that's designed to unlock your knee when your leg is straight. And if it's really loose on somebody like yourself, your knee can hyperextend. And then nobody can kick you in the back, like you said, and you're safe in middle school. So I don't know which one's better. Yeah. Thank you, sir. Okay. So the popliteal is the back of the knee. The patella is the front of the knee. The popliteal is the back of the knee. The patella is the front of the knee. I used to have a student who used to say, every gallon fella has a patella. And I don't know why it just stuck with me. It's one of those things like, I thought it was kind of cute. Every gallon fella does have a patella, by the way. You better hope they do. We have talked about the lower leg already. We have talked about the posterior leg being the surl and the anterior leg being the curl. It is cruel to get kicked in your curl, which is essentially your shins. Yeah. Couple more things. You're kind of like, remember your legs? I said this is not your legs ever, right? I said these are your legs, these are your thighs, or your femoral region. This is your femoral region. This is your leg. Well, this is not your arm. This is your brachial region, and these are your forearms. You don't want to break your brachial region. And these are your forearms. Forearms, brachial region. Brachial region. Brachial means arm, essentially, but... So you've got forearms and brachial region. Yes, Miss McDowell.
Is there actually a word for the forearm, like a medical term, if this is the brachial region? Because I don't see it on the...
Yeah, as far as I know, it really is forearm.
Okay.
Yeah. Yeah, and why is it not called foris armis, kind of thing? I don't know, but it's forearm. That's the only thing I've ever heard. Yeah. Did you have more to that? You raise your hand and put it back down. No, just a little accent there with your forearm. Yeah. Okay. So a couple more things that I'll quiz you on this stuff, right? And drive you nuts. Okay. Your pubic bone. I actually want you to touch your pubic bone because there's a reason. Your pubic bone is right here. It's where your two pelvises come together in what's called the pubic symphysis. And it is not your privates. It is right above. You should be able to touch your pubic bone, man or woman, without touching your reproductive organs. It's right above it, and it's a hard bone there. A lot of important abdominal muscles actually attach down there. That's what we pointed out.
Can you bring Bob up closer so we can see?
Bob?
Exactly. Yeah.
How do you get the name Bob? This is Victoria.
Oh, okay. Me and Hershey.
She got that name. Oh, no! Whoa! Victoria. She's been drinking. Sorry. It's Friday and she gets a little saucy. let's see here, I'll tell you what. Okay, so these are your hip bones. Oh boy, am I bad at this. Okay, these are your hip bones, and right here, that's your pubic symphysis. It's the symphony where these two bones come together. It's actually cartilage. And when you're pregnant, as you get closer and closer to birth, you release a hormone called relaxin that actually softens the soft tissue in your body, so this can spread a little bit so you can birth a child back here easier, because your hips need to spread a little bit temporarily. So, and that's because you're allowed some play in the pubic symphysis. But anyway, this is your pubic bone. This is what you're touching. I'm sorry to be so graphic, but this is what I'm touching if I push here and hit a hard bone. Does that help? Kinda?
Yeah, so on a male, that's like right above the knee.
Yeah, exactly. Yeah. You could, I mean, you wouldn't, I wouldn't do it for lots of reasons, but you could, in theory, touch it on a client without violating them if you knew what you were doing. I don't know why you would, but you could. So, right. But there are important stuff that attaches there. It's one of the reasons we're doing it. And I want you to be able to kind of think of the skeleton inside your body. That's why I like you guys to kind of touch and be like, oh, that's what I'm feeling. Cool. Now there's something else. Oh, I should have showed you this too. Man, what's going on? Scott, come on. They also have something there called the inguinal. Yep. The inguinal is an area right here. If you were to wear a high-cut swimsuit, it's where it would cut your legs. It's right here, and it comes from a term called the inguinal ligament. So bear with me. I'll tape it off for you and show you. And it's kind of an important landmark too. Well, I just need some tape here. Remember where I showed you where the pubic was? Well, if you kind of tie the hip to the pubis, you get the inguinal. So let me show you. If you tie the hip to the pubis, and by the way, you can touch this stuff on your body really easily. Right here, these two spots are those little protruding bones on your hips, right? You definitely see them on like supermodels when they're really skinny, but we can touch them on, it doesn't matter what you weigh, you can touch them on yourself. They're the two bumps here that you kind of feel. That's these spots here. And then you've got your pubic bone right here, and it's this line from that spot to this pubic bone. This is called your inguinal. There's lots of important reasons that we denote it. Like if I'm working your leg really up high, I won't go past your inguinal. For lots of reasons, by the way. One thing is your bladder's in here and your intestines are in here, and it's just not fun to have me go digging in your bladder and your intestines. But this is your inguinal. This line right here. Inguinal. Kind of where we'd saw off your legs if we were serial killers. I don't know why I had to tell you that, but I did. Okay. All right. Let's try and name some stuff. I hope you guys have your books because I'm going to stop sharing this. And I'm going to put this up here. And you might want to pin me to your screen, but that's up to you because I'm going to try to kind of go over stuff with you. All right. Oakley dokley. Okay. All right. Let's go. Miss Brown?
Yes, sir.
Thank you, ma'am. Hey, Miss Brown, what's this region here that I'm touching all over the place that's associated with ribs?
That would be the wait.
Yes.
Anything doing with
You're saying
that's right, thoracic region.
thoracic region. Now let's get more specific. What am I grabbing right now in the thoracic region?
Pectoral region.
What'd you say? You said it right. Just say it again.
The pectoral region.
Thank you. Good job. And what am I touching here?
Acromial region.
Yes. Good job. And what am I grabbing? What region am I grabbing here?
The brachial region, the
Yeah.
arms.
Yeah, it was fantastic. That's exactly right. Thank you. It was perfect. Miss Walker T.
Yes.
Miss Walker T, what region am I grabbing here?
The femoral.
Yeah! What region am I touching here?
The crural.
Yeah. Now this is kind of weird, but it's just what we gotta do. What region am I grabbing here?
The serum.
Yes! Very good. Thank you, by the way. Hey, what region am I touching here? I haven't said it, but it is in the book.
Plantar.
Yeah! What about here?
Dorsal.
Thank you very much. It's been a pleasure. That was really good. That was really good. I like that. Okay. Miss Routson? Hi!
Hi.
Hi. Miss Routson, what region is this right here?
That is your
Every gallon fella?
has a patella.
Yeah, your patella region. Good. Hey, let's turn the guy around. What's the region back here?
Popliteal.
Popliteal. Thank you very much. I like that. Hey, what's this region right down here? This kind of upside down triangle.
The sacral region.
It sure is. And last but not least, what's this up here?
The cervical region.
Yeah, how many cervical vertebrae do you have?
7.
Good. You should. That's good. Miss Allure? Hi, Miss Allure. Hey, what's this incredibly well chiseled region on myself called?
Mandible.
Yes. Emphasis on the man. Mandible, yes. And what's this region here called?
Facial.
Yeah. And what's this whole thing called?
Symbolic.
Yeah. And what's this kind of area back here called?
Cranial.
Yeah. Very cool. Very, very cool. Thank you, thank you, thank you. Hey, Miss Lobitz.
Okay.
Okay. All right, Miss Lobitz. Two of these I didn't mention at all, but they are on the book in those pictures. Okay, so I apologize. I just actually remembered I didn't teach them, so now you have to do my job. Okay. But before we get there, let's talk. What's this region up here?
Brachial.
Yeah. What's this?
The back. Cubital.
It is, and you said it correctly. That's what I didn't teach. Cubital. So what's this?
Antecubital.
Yes, that's the two things I didn't teach. Thank you. Oh, so you're really good at this. So that's like my elbow pit. So what's my elbow pit called again?
Antecubital.
Yeah, what's my armpit called?
Axillary.
Yeah, what's my knee pit called?
Popliteal.
You're a pit master. Thank you. Awesome. Good job. Okay. Hey, Miss Munoz. Miss Munoz, can you hear me? I can see you, but you're still muted.
Oh, there we go.
Okay, good, good, good. Yeah, don't give me a silent treatment. Okay. What region am I touching, Miss Munoz?
Cervical.
Yeah, how many cervical vertebrae do you have?
7.
Good. What region am I touching here?
Thoracic.
Yes, how many thoracic vertebrae do I have?
12.
Yes, what region am I touching here?
Lumbar.
Yes, how many lumbar vertebrae do I have?
5.
Yes, what am I touching down here?
The sacral.
Yeah, how many sacral vertebrae do I have?
1.
Good, right, good, thank you, ma'am. That's good. Trick question, trick question. Okay, good. Miss Walker. Hi, Miss Walker.
Hello.
What region is this?
Plantar.
Yeah, what region is this?
Palmar.
Yeah. What region is this?
Dorsal.
Yeah, and what region is, oh, I don't know if you can see it. What region is this?
Is that also dorsal?
Yes. Yeah, thank you. That's the point I was trying to make. Awesome. Thank you, ma'am. Miss Modis.
Yes, sir.
Miss Modis, I didn't talk about this, but I know you're super smart, so it won't be a problem at all. Miss Modis, what's this region here, my wrist region, called?
Would that be the
It's a-
metacarpals?
Pretty close. Take away the meta. Just tell me the next part.
Carpal.
Carpals. Yeah,
Carpal.
carpals. You guys have bones in here. You've got 8. Just so we all know, we have 8 carpal bones. Cool. Carpals. Yeah, cool. And what do you call these? These things wiggling around.
The phalanges.
They are phalanges. Yep, that's the bones. The region's called your digital region.
Oh, digital.
Yeah, digits. You're absolutely right. They're made up of phalanges. There's no doubt about it. Okay, cool. What's this region right here?
That is the inguinal.
Inguinal. And what's this region right here that the inguinal goes to?
The pubic.
Perfect. Thank you. Thank you. Thank you. Okay, Mr. Placencia. Mr. Placencia, what region is this back here?
That is your gluteal region.
It sure is. All right. What's this region between it on both sides? Yeah. Yeah. What's this bone-in area here called?
Lumbar.
Yeah. What's this whole region that wraps around me? You've got these bones all around me.
Thoracic.
Yeah. What's this region here?
Pectoral.
Good. What's this, sir?
That apple is the foot. Cubital.
Yeah, it's cute. Cubital. What's this then?
That is the antecubital.
Yeah. Good job. Thanks, sir. Hi, Miss Suriel.
Hi,
Hi. What's this called?
that is called dorsal.
It is called dorsal. What's this called?
That is called carpal.
Yeah, you've got bones in there. Carpal bones. How many carpal bones do you have?
You said 7?
I said 8.
8.
Okay, good. Whew. Thought I was missing one. 8 carpal bones. And what are these?
Those are digital. The digital
Digits.
region.
Yep, digital, digits, all that sounds good to me. Thank you, ma'am. Thank you. Let's see, where are we? We've gotten everybody kind of. Miss Vincent? Oh, wow. What region is this? The whole thing?
Cephalic.
Cephalic. What's this?
Mandible.
Yes, what's this?
Facial.
Yeah, what's this?
Cranial.
What is the area just above my collarbone called? Right in here.
Clavicle or
Well, this is my clavicle. What's the area right above my clavicle called?
supraclavicular.
Yeah, which literally means above the clavicle. Supraclavicular. Cool. Thank you. Thank you. Miss Estes. Miss Estes?
Yes,
What region is this?
it is the femoral.
Yeah, what's this thing right in front? What's this region right here?
That is the patellar.
Yeah, patellar region, yeah. What's this region here in front?
The crural.
Yeah, what's this region right here on top?
Dorsal.
Yeah, strangely enough. What's this region underneath here?
Plantar.
Yeah, what's this
Yeah.
region here?
That is the sural.
Yeah, just a very flexible person here too.
Yeah.
Oh, hey, what's this region back here?
Back there is the that's the popliteal. Popliteal.
Popliteal. Beautiful. Great. Good. Okay. Whew. All right, let's see. I know I didn't get to everybody, but I think we have a fairly good idea of what we're talking about so far. Yep, this will be in your homework. Let's take a 10-minute break, by the way, and then we will talk about planes and all that good stuff because they're coming up, not airplanes. Frontal transverse. we've already learned some of these directional terms we're going to talk about. Stuff that is up or above something else is superior. And by the way, this doesn't mean high up. Okay? My chin is superior to my belly button, but my belly button is superior to my popliteal. My popliteal is superior to the dorsal region of my foot. So superior just means above. Yes, Miss McDowell. Miss McDowell, you have your hand up?
Oh yeah, sorry. I was putting in my headphones. I didn't understand the transverse plane. So you were talking about it, and I think I might have missed what you were saying. So like, if my arms are up here and they go like down, do they go through the transverse plane?
Yes, they do. Yeah, yeah. Planes are super confusing. We use them to describe movement, and you really have to imagine this plane going on forever. And if you can imagine a transverse plane going on forever here, if I rotate, I'd stay in it. It's just the best I can explain it. Yeah. Yeah. In a way. Hello. All right. Okay. So, superior, inferior, right? But inferior doesn't mean bottom, it just means below something else. My mandible is inferior to my facial region. My facial region is superior to my mandible. Cool? Cool. Okay. They also use cranial and caudal. Cranial means towards the head, by the way, and caudal means towards the feet. These terms are almost not used anymore. So I don't really want to emphasize them because we're not going to use them. We'll talk about the cranial region, but we don't use cranial usually as a superior. We just use superior and inferior usually. These terms are almost outdated. Okay. So let me ask you some questions. All right? So, Miss Trotter, what is the relationship of my mandible to my thoracic region? I'm looking for superior, inferior.
Yeah, so the mandible would be superior to thoracic, but then the thoracic would be inferior to the mandible.
Perfect, yeah. Okay, I'm going to ask that type of question a couple more times. You guys only have to tell me one way. By the way, Ms. Trotter, that was fantastic, but I just meant like, it was, yeah. It would hurt my head. Yeah, okay. So, Miss Estes, what's the relationship between my patella and pubic region? You could say it either way, right?
So your patella is inferior to your pubic region.
Beautiful. And she could have also said, by the way, my pubic region is superior to my patella. I didn't care. They're both true. I just wanted a true statement. Thank you. That's exactly what I'm looking for. Good. Miss Suriel?
Yes?
What's my relationship between my thoracic region and my lumbar region?
That part is very hard for me. I don't get it.
Okay. Which one is higher up, my thoracic region or my lumbar region?
Your thoracic.
Yes. Okay. So that's cool. Now we just have to translate that. So we would say superior means above. It means better. That's super. That's what it comes from. So which one is superior, my thoracic or my lumbar?
Your thoracic.
Yes. And my lumbar is inferior in this case. So we're just saying any two objects you pick, any two things, it doesn't matter what you pick. We would say this one's superior and this one's inferior. And you just did that.
Oh, okay. So it doesn't, yeah, because I was reading about the proximal and distal, and that's why I got so confused. Like, does it have something to do with that? This is different.
It is different. It is different. We're going to get to proximal and distal in a second.
Okay.
Above and below. Above and below. We do this a lot because, well, like the supraclavicular region, we can talk about an infraclavicular region. It just helps us talk about stuff in the body. It is different than distal and proximal, and you are reading ahead. and we'll get there in a second. Okay, thank you. Mr. Placencius. Good sir. Tell me about the relationship between my cervical and my thoracic region.
Your cervical would be superior to your thoracic.
Perfect. Thank you. All right. Good. Let's move on. Okay. We talked about posterior and anterior, right? Ms. Mates, in very simple terms, what does anterior mean?
In front of the
In
body.
front. And what does posterior mean?
It's the back of the body.
Yeah, cool. Thank you, ma'am. And we also talked about medial. Medial does not mean middle. No, it'd be easy to confuse them, but I will give you many examples. We will have many examples in anatomy where medial does not mean middle. Middle means between two things. That's what it means. This tape is in the middle of these two pens. This tape can be over here. It's not medial. It's in the middle. Now, this tape is now medial and in the middle of these two pens. Middle means towards the midline of your body. And yes, the midline is in the middle of your body, but they are different. They really are. You will see later. So, medial means moving towards the midline. Moving towards the midline. Lateral means moving away from the midline. So right now my hands are moving medially. Right now my hands are moving laterally. And we will use this for describing movements too. Yeah? Cool. We're going to tie all this together in a second. We also need to learn about depth because bodies are thick, thank goodness. We are not back rubbers here. We actually go under the surface of the muscles. We get down to all the layers. We care about layers. We're going to start thinking like submarines and stuff like that. We are going down into layers. And so we care about superficial and deep. Superficial just means on the surface. Deep means deeper. And they are relative terms. Just like inferior and superior. So hold on. I need more and more props apparently. Bone, blue tape, pink highlighter. The blue tape is deep to the pink highlighter, but it is superficial to the bone. So deep doesn't mean the deepest, it just means deeper than the other thing you're talking about. So people don't usually say it's deep, they say it's deep to something else. The blue tape is deep to the pink highlighter. The bone is deep to the pink highlighter. The blue tape is superficial to the bone, but deep to the pink highlighter. Is that confusing? No? Okay, good. Well, alrighty then. Proximal and distal. Or as I should say, proximal and distal. Proximal means in close proximity. Distal comes from distance and it means far away. Proximal means closer to the core of the body. Distal means farther from the core of the body. They are also relative terms. So, my elbow is distal from my shoulder. It is further distance away from the core of my body. My elbow is distal from my shoulder, but proximal from my wrist. It is in closer proximity than my wrist to getting back home to my core of my body. Yeah? Good. We normally use these terms with limbs. we don't normally use these terms like with your spine, because you can't get closer. Your cervical region can't get more proximal really than your lumbar region. It doesn't work that way. We normally use these for limbs, and we use them, by the way, quite often to describe strokes. So right now, I am rubbing my arm proximally. I'm getting closer to my midline. Right now, I'm rubbing my arm distally. So we'll use it for terms like that. Yeah? Yeah. Okay. Check it in. All right, so we got to put all this together. Right now, we've got posterior, anterior, superior, inferior, medial, lateral, superficial, deep, superficial, deep, superficial, deep. Depends on what the relative thing is there. Proximal to my shoulder, distal. This is distal to my shoulder, proximal to my wrist. Proximal and distal. Okay, so let me ask you some questions right now. Mr. Tate, sir. Mr. Tate, how am I rubbing my arm right now? Proximally or distally?
Approximately.
Yes, I'm getting in closer proximity to myself. Thank you very much. Thank you, thank you, thank you. Miss Allure, how am I rubbing my arm now? Besides poorly.
Distal?
Distally. Yeah, absolutely. I'm getting further away. Yeah. Hey, Miss Lobitz, what is my elbow in relationship to my wrist? Proximal or distal?
Proximal.
Yes, my elbow is closer to my main body than my wrist. It is proximal. It's in closer proximity. Thank you very much. Yeah. Miss Walker, why? What is the relationship of my elbow to my wrist?
Your elbow is proximal to your wrist.
Yeah, it's in closer proximity. Thank you very much. Yeah, very good. Hey, Miss Trotter, what is the relationship of my wrist to my elbow?
Proximal.
My wrist is closer to my body than my elbow?
Wait, wrist to the elbow. Oh, now you're confusing me. That's distal. Oh wait.
Distal, yes, it's distal.
Yeah.
You're good. You're good. Don't worry.
You're confusing me there.
By the way, and Miss Hanson will let you know this too, that will never go away. We will make those mistakes, and you will catch me make those mistakes for the rest of class. It just happens. There's too many like superior, proximal, middle, and you just flip stuff all the time. And then I start messing with you later too, when you get about halfway through. So, okay, very, very good. I like all this. That's good. Miss Carodi. Miss Carodi, which way am I pointing? Yeah. Superior, yes. Miss Jong, which way am I pointing? Inferior. Yeah, that was great. Good job. Thank you. Miss Sarno, which way am I pointing? Me.
Middle.
Yeah! Bam! Knocked out of the park. Thank you. Let's see. I think that covers stuff pretty good. All right. So let's talk about movements. This is why we did all this. We need to describe movements because later we need to describe why they're working or not, what muscles are moving them or not, and this is the basis to kinesiology. But we have to be able to describe movements, and we can't describe them without kinesiology. So I'm going to pull the slide away for a second because I want you to pay attention to me for a second before we go back to the slide. Okay. And then we'll go back to the slide. And then you'll take a test over the weekend on this, which won't be, it's an open book test, and you'll figure all this stuff out. Okay. What's the plane that goes through my body and divides me from side to side, but it's like goes on forever this way?
Sagittal.
Sagittal plane. I am moving in the sagittal plane right now. I'm moving in the sagittal plane right now. Okay? Movements in the sagittal plane, front and back, tend to be flexions and extensions. We call them flexions and extensions. In general, and I'll show you all this, in general, flexions happen in front of you, and in general, extensions happen behind you, except for the knees. Can you see my hands even? I hope. See my fingers? I'm flexing my fingers. I'm flexing my wrists. I'm flexing my elbows. I'm flexing my shoulders. I'm flexing my neck. I'm flexing my waist. I'm now extending my neck, extending my elbows, extending my arm, extending my wrists, extending my fingers. I don't actually have to go back behind me, but stuff where I'm moving back this way are extensions, things where I'm moving this way are flexions. The only exception is the darn knees. Flexions tend to close an angle, and when you close an angle with your knee, it happens behind you. So this is a flexion. That's an extension. It's the one flexion that happens behind you. But everything else happens in front. Okay? All right. Okay, so Mr. Blygen, I'm moving in the sagittal plane here. I'm going to stay in it the whole time. And Mr. Blygen, what am I doing right now?
You're doing a flexion.
Yeah. And if you want to be even more precise, I'm doing a flexion on my neck, right? The thing that's bending, we usually call that. Flexion on my neck. Cool. Love that. Okay. Thank you very much. Mr. Brown. Mr. Brown, you there? Did you wake up? Mr. Brown. Mr. Brown. It's dream time. Come back to that. No? All right. It's worth a try. Okay. All right. Miss Walker T.
Yes.
Hi, Miss Walker T. Miss Walker T, what am I doing right now?
Flexion of the neck.
Thank you. What am I doing right now?
Flexion of the elbow.
Yeah. What am I doing right now?
Flexion of the first digit.
Good. Hey, we'll take it. Second digit, but we'll take it, yeah. Very cool. All right. Now, by the way, everybody, remember anatomical position. So flexions happen kind of in the sagittal plane when you're in anatomical position. But out here, this is still a flexion because we imagine me down like here doing it. So this is still a flexion, I hate to tell you. Back here, it's still a flexion because we imagine me here doing it. Does that make sense? Yeah? Yes, Mr. Rydell, please.
Yeah, so what is considered an extension?
Oh, all right, so watch this. Do you see this? What's that?
Flexion.
That's extension. Anything that's the opposite. Yeah.
Oh, okay.
And by the way, I haven't forgot about you, Miss Walker. By the way, it's the movement. And here's what I mean by that. This is me flexing. This is me extending. What am I doing right here? Nothing. These are movement terms. So, this sounds very weird, but I am flexing. The minute I go back at all, that's extension. If I change directions, it's flexing again. It's not where I'm at, it's where I'm heading. If you are heading towards closing an angle in front of you, that's flexing. If you're heading towards opening that angle and back you, that's extending. This, what I'm doing right now, is nothing. This is nothing. How I got here was something. This is flexing. It's flexion. It's a movement. We are describing movements. We're not describing this. We literally can't describe this with these terms. This is just weird guy with bent elbow staring at me awkwardly. That's what this is. Okay? But we actually don't describe this. You literally can't tell what I'm doing with this. It doesn't matter where it is. I could be in an extension right now because I'm moving this way. We just don't know. Cool. Miss Walker, why? You have your hand
So
raised.
when you were showing the flexion from this angle, that's a different plane, right? That's
It is, but we pretend that I'm in the normal plane.
okay.
Flexions and extensions are closed from the anatomical position. We pretend I'm in that position, and we call all this stuff flexion, section, an extension, flexion, extension. Even if I do something weird, we say, well, we pretend he's doing it, but we still call this a flexion and extension.
Okay.
Yeah, that's the pretending part. Yes. Cool. So flexions and flexions normally happen in front of you. Extensions happen as you're moving behind you, right? So right here, I'm not doing anything, but now I'm extending. Extending, 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 flexing. Cool? All right. Good? So we're going to talk about different types of flexions, but I want to kind of give you this preview of coming attractions, right? The other thing is, we have movements out to the side. What's the plane that cuts me through this way? From front to back? From front? Yeah, frontal. Thank you. This type of stuff stays in the frontal plane, and these aren't called flexions or extensions. These are called abductions and adductions. When I am adducting, adding back to the midline, this is an adduction. When I'm going away, abducting is going away. That's true with my legs too. If I'm doing jumping jacks here, I just abducted, adducted, both my legs and arms. Believe it or not, even this is abducting, adducting, adding back to the midline of my hand. Abducting, adducting, flexing, extending. Abducting, adducting, flexing, extending. Cool. There are a couple other nitpicky things, like my neck is kind of weird. This is a flexion, this is an extension. We call this a lateral flexion because we don't know what else to call it really. It can't leave my midline really, and so we don't call it an abduction, so we call it a lateral flexion. And this is lateral flexion too, and I take my whole body over there. When you do side crunches, those are lateral flexions. So let's look at these pictures now and see if they make a little bit more sense. There are some other things on there, but this is the main stuff. Oh, shoot, it's not the main stuff. I need to show you one other thing. Sorry, bad teacher. One other thing is rotations, right? This is me rotating, right? Well, my arms can rotate. They can rotate in and out, right? And my legs can too. My arms can rotate in and out. When they roll towards the middle, we call that a medial rotation. When they roll towards the outside, we call that a lateral rotation. We care about this because some people come to us very medially rotated like this. Just like that. They come in just like that. Right? And we try to laterally rotate them. So we do have rotations too. And we're going to learn about a couple things with forearms, stuff like that, but don't worry about that. Now, I think we're ready until I change my mind again. Okay. All right. So, we see some really basic concepts here. This is in your book. We see the fingers closing. That's flexion, opening, extension. We see the legs going apart, abduction. The legs coming back together, adducting. We see a medial rotation here of the arms and a lateral rotation of the arms. Some of this, I hate to tell you, you will just have to go through your book and take the test and kind of think about it as you do it, right? They also have some examples here of side flexions and things like that. But let's go through. Oh, and I didn't talk about elevations and depressions. But elevators go up. I have elevated shoulders right now. I have depressed shoulders. We can even use it to talk about my jaw, believe it or not. I have an elevated jaw right now. I have depressed jaw right now. It's open. It's down. Depressed is down, elevated is up. Okay. So let's look at some of the examples they have here. One of the things they show you here that is not flexions and extensions is stuff with your feet. For some reason, whoever talked about all this stuff decided they wanted to do stuff different with feet. By the way, Miss Walker, why do you still have your hand? Do you have a question or no? We're good. Okay. Your feet, they don't use terms like just flexion extension like they should. When I am standing up on my tippy toes, that's called a plantar flexion. When I pull my toes up towards me as though I was stopping a door, stopping it, that's dorsiflexion. Plantar flexion, dorsiflexion. Why do they give them both flexions? I don't know. It drives me nuts. Plantar flexion, when you do calf raises, I plant my foot so hard I lift up. Dorsiflexion, I pull my toes and foot back so much I can stop a door. Speeding down the highway, plantar flexion. See a cop, dorsiflexion. We also look at people's feet and how they point. If my bottoms of my feet are pointing in, that's an inversion. If the bottoms of my feet are pointing out, that's an eversion. Now, obviously, nobody comes to you like this. Well, some people do, but it's rare. But they will come to you with mild eversions and mild inversions, and we care about that. This is all in your book. We won't talk about deviations too much, but lateral deviations are usually used with your jaw to say your jaw's not lined up right. They use it in the dental industry all the time. But yeah, some people are really good at moving it to the side. Miss Trotter's doing a really good job right now. She can move her jaw to the side. I have a hard time with it. It's just my lips moving. I can't get my jaw to move. It's ridiculous. Anyway, it's good, by the way, if you can laterally deviate a little bit on purpose, Miss Trotter, because it means you've got some play in your jaw, which you should have, which is good. The other thing I can do is protract and retract. I can push my jaw out. You all do it, actually, when you chew. You don't realize that. Your jaw is not just a simple clap, clap. It actually kind of comes down and back in. But anyway, when my jaw goes out, that's protracted. When it comes back in, that's retracted. We use this term to also talk about the scapula. When we get to it, I'll show you. It's very important there. But to retract is to take back, right? I will retract that statement. I will pull back that jaw. Protract is to stick out, to elongate. Okay, these are some very good pictures of a guy doing flexions and extensions and lateral flexions even. And he's showing you those with his torso, his spine flexing, and his neck flexing, which is actually part of his spine, but his cervical region flexing. So lateral flexions, flexions, extensions, rotations. And notice they don't just show you guys stuck in the position, they show you an arrow of which direction he's going because he has to be moving to be doing something. Me doing this is actually not me laterally flexing, it's just me hanging out crooked. I have to be moving that direction to be laterally flexing. All right. When you breathe, your rib cage elevates as it fills up with oxygen. You can even kind of watch it, right? As I take a big breath, it comes up a little bit and let it out, it drops, it depresses. It's supposed to. We will care about this as massage therapists too, because some people's rib cages get kind of locked down and it's hard for them to breathe deep. Believe it or not, they kind of create these bands of tension around their ribs and they don't even know it. You'll say, do you have a hard time taking a breath? They'll be like, oh, I do. I didn't even notice. Yeah. And it's tied with shoulder tension and all sorts of stuff. But elevation, your ribs actually do elevate when you inhalate, when you breathe in. And they really do depress when you exhale. And they're supposed to. All right, this is the stuff that's tricky. Scapulas. Scapulas. All right. When scapulas come closer together, we call it adduction. They are getting closer to the midline. And when they get further apart, we call it abduction. and they can rotate, and they can elevate, and they can depress. So let's take a look at Mrs. Skeleton here, because otherwise it won't make a lot of sense. All right. So, the problem with your scapula is that your arm's attached to it, and we confuse arm movements with scapular movements. This is an arm movement. I'm not necessarily moving my scapula for this stuff. These are scapular movements. Elevation of my scapula, not my arm. My arm comes along for the ride, but elevation of scapula, depression of scapula, abduction of scapula, adduction of scapula. This can also be called protraction of scapula, retraction of scapula. Upward rotation of scapula. That means my scapula is kind of rotating up. So let me describe that to you here. We'll take our skeleton here. This is her left scapula. It can get this close to the spine, just so you know. That is adducting. This is it abducting as it comes this way. This is it elevating. This is it depressing. And this is it upward rotating. Now, rotations are very hard to discuss, and they throw people off because of this. Let me explain something. Hold on. Okay. Yes, Mr. Beligen. Yes, sir.
You can finish your thought. I'll ask that after you finish.
No, go ahead, sir.
So earlier today, during my massage, I was working on Miss Routson, and she was prone, and I was working on her scapula, and Mrs. Bauer showed that we can get underneath the scapula in that position when the arm is, extended.
Yeah, probably. You probably had the shoulder extended and the elbow flexed behind her back. That'd be my guess.
Yeah. So, what is the scapula doing in that position? Is it rotating outward or not rotating? Yeah, rotating.
It's abducting. What they're doing is taking your arm as a lever and trying to get the scapula to pop up off your shoulder. They're kind of doing to you what a cop does when they lift your arm up like this. It actually pulls your scapula out like this. And they're doing that so they can get their hand underneath your scapula. So, it's kind of abducting, but the reason it's popping up here is they're winging your scapula. It's called a winged scapula. They're forcing your scapula to wing. And a winged scapula allows me to get my hand under there. But it's not exactly a movement.
Okay.
Sorry, I know that wasn't very helpful.
No, it was. I just wanted to know if that wasn't movement.
Can we see the circle with the orange and yellow tape on it? When I turn it, do we notice that the orange tape goes down, but the yellow tape goes up? And do we notice when I turn it this way, orange tape goes down, but the yellow tape goes up? The problem with describing movement in circles is, how do you describe which way this thing's moving? So what most people do on stuff like this, where it's like, well, that's going up, but they're like, but that's going down. Okay, well, that's going up, but that's going down, is they say we're always going to talk about the orange tape. From here on out, we're going to forget about this thing over here. If we say up, it means the orange tape went up, even though that went down. If we say down, it means the orange tape went down, even though that went up, because they're circles. Now, I know a scapula is not a circle, but when your scapula rotates and this goes up, some other stuff tends to go down. But we have decided to use the acromion process to discuss rotation of a scapula. If the acromion process goes up, it's an upward rotation. If the acromion process goes down, it's a downward rotation. This is our yellow tape. We just said that's it. We're not going to talk about the bottom, the sides, because it gets too confusing. We're going to talk about the acromion process. When it goes up, it's an upward rotation. When it goes down, it's a downward rotation. Why do we care? Because without scapular rotation, I can never go above here. That is the extent of my glenohumeral joint, my shoulder joint, the ball and socket here. That's it. I can prove it to you. You can put your hand on your acromion process right here. Keep it at this level and try to get your arm above here. Don't let the acromion process come up at all. If you want to get up higher than this, the acromion process has to come up. That's how you get your arm above your head. I don't care how flexible you are. This is it. That's the limit of that. So what happens is, this is literally what happens. You come up like this, you actually hit your acromion process right here. That was me with my arm out. Can't get any higher, right? And then I rotate my scapula to get my arm up higher. Now we will go into gory detail about shoulders later, and I mean gory detail. But this is actually two different movements. It's an abduction of my arm, my glenohumeral joint, and an upward rotation of my scapula. It's two movements. So that's why we care about rotations. I just want to give you some reference to the real world. Right? And the same thing is true here. If I put my arms out like this is kind of as far as my arms can get out when my scapula is retracted. But without stretching my arm anymore, if I protract my scapula, I'm bringing it forward, I get to get really far up here. This is me abducting my scapula, as opposed to adducting my scapula. That's just scapular movement. That gives me a lot of movement. So the arms are on these scapulas that are moving around. That's why we care about protractions and retractions and adductions and abductions of the scapula, and elevations and depressions of it, and rotations. Cool? You don't have to get all that, but you get the general idea. Okay. All right. Let me continue sharing here really quick. And then we will take it from there. Okay. So these are, let me just make sure I didn't go too far. Hold on. Yeah. These are great pictures of adductions and abductions. And again, it has nothing to do with how far this guy's arms are away from his body. It's whether they're moving closer back down to the midline, that is adducting them, adding them, ADD, adding them back, or away, abducting them, they're going away. Whereas when he's moving his arm in front and back, those are flexions and extensions. Flexion, extension. Abduction, adduction. Rotations, rotations. Medial rotation, lateral rotation. All right, questions about that so far? We're going to use this stuff a lot. This is just introductory, right? Good, but you get the concept at least. Okay. Mr. Brown, by the way, I'm just giving you one last shout out just to maybe see if you're there. Mr. Brown?
Oh, I didn't hear you call on me, I'm sorry.
Oh, that's okay, Mr. Brown. Well, we've missed you for about an hour, sir.
An hour?
Yeah. Yeah. Look at the clock. Yeah.
Oh, I'm here.
All right. Well, good. That's good. Okay. So, we have not talked about this. Well, actually, we did like in the first stage a little bit. When I turn my hand up like this, like I'm going to hold a cup of soup, that's supination, pronation. But it's true even if my arm's down by my side, by the way. I mean, right now, I'm supinating, and right now I'm pronating. Supinating, pronating. Supinating, pronating. Use this when you turn a doorknob. But we also use it to describe how somebody's laying on the table, right? When they're face down on their tummy, they're prone. When they're supine on their spine, on their back, they're supine. Again, this will all be in your stuff. So this stuff is kind of interesting. You guys know this. I showed you this, right? I am flexing right here, right? I'm flexing my wrist. Okay, and I'm extending my wrist. So here's what's weird. In anatomical position, what if I move my wrist out to the side? That's abducting my wrist. This is adducting my wrist. Can you see that, Miss McDowell? Abducting my wrist, adducting my wrist. You see that? All right, Miss McDowell, I've got a question for you. So turn on your voice so I can hear you. So Miss McDowell, what action am I doing right now with my wrists?
Adducting.
Which one?
I don't know, I get confused with adduction and abduction.
Add is adding back to the midline.
Okay. So you're abducting.
That's right. And now what am I doing?
Adduction.
Adduction. Okay, so this is terribly mean because you're already confused. But this is now I stand like this. So what am I doing now?
Stop. It's trying to help me. I can barely see you.
Oh yeah, well I don't blame you. Here, I was kind of standing like this and I said, what am I doing now?
Abducting.
Let's put me back in anatomical position. So back in anatomical position, I'm adducting.
Okay.
And this is, by the way, I'm not trying to give you a hard time. I'm trying to make a point to everybody that, yes, this is away from the midline, but we always imagine the person back in anatomical position. So this is actually adducting when I'm walking weird like this. Because we imagine them back like this. And back like this, my wrists are moving towards the midline. I'm just trying to make a point about assuming somebody's in anatomical position. Yeah. Okay. Okay. I'm not going to get too much into finger movements, but again, this is abducting. This is adducting, back to the midline of the hand. Yeah? This is flexing. This is extending. This is one of my favorite ones. Your thumb and pinky crossing over your hand is called opinating or opposition. What's cool about it is very few mammals can do it. Not only humans, but very few mammals can do it. And it allows me to do things like this. The reason we're so good with tools is that we can bring stuff from this side of the hand over to this side of the hand. And your guys are like, well, whatever, right? But, if you look at most primates, when they get their hand like this and they go to grab something like this, they'll grab it like this. Or they'll grab it like this. And you'll see a lot of this kind of grabbing because they can't bring their thumb and pinky across. They can't do this, which is how we manipulate tools. So my thumb doesn't just abduct. The fact that it can cross over and stuff is what, it can work in opposition is what makes us so dexterous. It's kind of cool. Just food for thought. We've already talked about this. Let's talk about, I think this is one last thing. Remember how I said it's difficult to talk about circular movements? You just have to pick a spot and talk about that. For the scapula, it's always the acromion process. If it goes up, it's an upward rotation. If it comes down, it's a downward rotation. Well, we had to do the same darn thing with the hips, right? Because your hips do this really annoying thing. Here, let's do it with this. Your hips are kind of circular too. And they can rotate forwards or back. The problem is, when the top rotates forwards, the back rotates back. When the top rotates back, the back rotates forward. So how do we talk about it? We pick the top. We talk about hips from the top. So look at me. It'll look ridiculous, but you're gonna get used to it because you're gonna see a lot of it. All right. So, my hips here, we picked the top. This is called an anterior tilt. My top went forward. But look what happened. This is somebody anteriorly tilted, which strangely enough makes their posterior stick out. If I posteriorly tilt, my posterior actually comes back. So when I rotate this way, the top does go anteriorly, frontwards, and we call this an anterior tilt, even though the bottom went back, because it's a circle. It's a circle, right? When the top goes forward, the bottom goes back. When the bottom goes, right? So we talk about it from the top. This is posterior tilt. This is, this is anterior tilt. This is posterior tilt. And that's why we have to pick a spot on top. I hope that makes sense, but it will later when we do more. So when we say, is these hips tilted anteriorly or posteriorly, look at the top of the hips. Strangely enough, when somebody's anteriorly tilted, their butt's sticking way out and back, because that's what happens. And by the way, they also showed you lateral tilt here, which is one side up. That's a problem. They're all problems, but that's a problem. Hey, by the way, though, I really need to kind of remind you all of this too. Every one of you will have some of this stuff in your body. Like, your bodies won't be perfect. So that's normal. Like, don't overemphasize it too. Everybody's hips are a little bit funky, or their back, or their arms, or whatever. Like, you'll find it's just interesting after a while. It's not that you're all messed up and it's the end of the world because I'm anteriorly tilted or something. Don't worry about it. All right, I want to make one other point because it makes your test easier. Do you see this guy kicking a ball? Do you see the red dot on his hip? The red dot means that's the motion they're talking about, because it looks like his knee is bending too, and it might be, but they're not talking about the knee bending. They're talking about the hip bending. The red dot is to show you what joint they're talking about. Right? Because actually on the bottom picture, where the hip is extending, his knee is flexing, it looks like to me. His knee is coming under. But they're talking about the hip. That's what the red dot is for. They're saying what is bending at this place, and his leg going back is an extension at the hip. Cool? This is an example where they're talking about the knee. Do you see? This knee picture is the same as this hip picture, but the knee picture is a flexion of the knee. Extension of the hip. Flexion of the knee, extension of the hip. Okay. And we talked about inversions, eversions, and plantar flexions and all that good stuff. All right, that's it.